And welcome back to Central Valley Talk. I'm Mike Scott. We're going to discuss Amdal In Home Care right now with Deanne Martin-Soares, offices in Fresno, Tulare, and Atascadero. How are you?
Very good.
Thank you for coming in today.
Thank you.
Amdal In Home Care. What exactly is it you do?
Well, we take care of elderly that want to stay in their own home. And so...
I would want to.
Well, of course, everybody wants to.
Yeah.
The big question is, can you afford to, unfortunately?
Wait a minute. Why would it be more expensive? Well,
it is.
To have a nurse come in?
No, not a nurse, not a registered nurse. It's usually going to be a caregiver, which is CNA level. But if you truly want to die at home with dignity and you are bedbound, you need to be turned every couple hours, maybe you're incontinent, things like that, then that requires an hourly caregiver. And so, 24 hours a day, 7 days a week, it can get pretty costly. So,
does insurance cover a lot of that or not?
If you purchase long-term care insurance, but most people, I would say company-wide, out of everything that we bill, it's probably maybe 10% of our business. Maybe it's edging up to 15%, but the majority of our business is private pay. So most people didn't think they were going to need it, and it's really only been around since about the early 80s anyway. So not a lot of people purchase long-term care because it's expensive.
Yeah.
But when you're thinking of a policy costing you $500 to $600 a month, you don't anticipate that care can cost as much as $10. So a month. Oh, it can cost more than that, but yeah.
To have somebody come every hour.
Every hour, around the clock, can run you it's running probably about almost $12,000 a month.
And you're saying that 85% of your patients are paying that out of their own pocket?
Well, but let's say that is the worst scenario, that you want to die
Not
at
everybody
home.
needs
Not
that
everybody needs that level
extensive
of care.
Okay.
I mean, the average of our clients, I would say on average, the average person is maybe receiving care 2 to 4 times a week, maybe to come in and assist with bathing, those type of things. Because as you age, I mean, you run into the risk of falls. So, and you look like you're a pretty young guy. I mean,
thank you.
I don't know that you need help with bathing, and I'm not offering it. So, if someone needs assistance with that type of thing, because if you should fall and break a hip, I mean when you're 90 years old, that's a real problem.
Yeah.
And so it's all about staying safe in the home, and if you stay safe in the home, you can stay there a lot longer. And most people don't want to leave their home. If they have their choice, they'd like to stay at home.
When that happens, when somebody breaks their hip and it seems like your whole life would change instantly. You can't go out anymore. You can't drive until you recover. That's where you guys come in and
usually
take over?
I mean, obviously, if let's say you have to have surgery, somebody, if they're up there in age, it's pretty tough on the body, and so just to undergo anesthetic and have a surgical procedure. So you're usually going to have some time in the hospital. You're going to end up having a recovery in probably a nursing home, and physical therapy is going to work with getting you moving and grooving again, so you can get back home. And then once you're back home, you may need assistance for a little while, and some people will completely recover and be fine. Others probably that's the beginning of maybe some decline, that they might need some assistance. One of the things that really happens as you age is people don't usually eat well, and I see that as a big problem. We actually trademarked the word NOAA, which stands for nutrition, oral care, ambulation, and hydration. And those are the 4 main things that people need as they age.
Run through each of those.
Nutrition, which in essence you need to eat well. Your body protein wastes as you age, and so you really need to have good nutrition and not junk food. I mean, you need some good protein. Clean protein is what's needed. Oral care, your mouth is a conduit to your lungs, and so sometimes as people age, they don't always take good care of their mouth, and so if your mouth is a really nasty place for infection, and so it can migrate down into your lungs. Let me get it in order. Ambulation. Everybody needs to keep moving and grooving to the best of their abilities. Even if the best of your ability is to sit at the edge of the bed once a day, twice a day, you need to keep moving, because if you lay in bed, you're going to get worse. And so you've got to keep moving. And then hydration. Our body is made up of 70% water. People need to stay hydrated. And if you take a lot of medication, a lot of medications, one of their side effects is dehydration. So a lot of times elderly, they will become dehydrated, and then that leads to a lot of other problems like urinary tract infections and all kinds of wonderful things. So you probably don't want to talk about urinary tract infections, do you?
Bill, you want to? No, listen, you told me you were a registered nurse.
Yes.
But your whole staff isn't nurses, right? It's just a
No.
lot of,
No.
what kind of training do they have?
Well, for us, people have to skill level test. They have to have at least a year's experience in this field. A lot of places like assisted livings and nursing homes, they may be employing what's called personal care attendants or CNAs. But when you're in the home environment, there's not a lot of supervision. So we have to have people with experience. They have to skill level test. So they are equivalent to like a personal care attendant or a CNA level. So no, having a registered nurse in the home would cost a lot of money. So unfortunately.
Yeah. All right. Where can folks find out more about Amdal In Home Care?
Well, we have a website. It's amdalinhome.com. We are on Facebook. We have an app that you can download, Apple or I guess smartphones.
Android.
Thank you. Thank you. So we have an app, and you just would search for Amdal, and there's lots of good information there, and you can definitely read about NOAA there as well. So, yeah, we have lots of, I think we have Pinterest and Tumblr and all those other things.
Well,
that,
you've got all the bases covered.
yeah, not from me.
You have to these
People
days.
that are younger than me doing that. Thank you.
Yeah, thank you for coming in.
All right, take
Appreciate
care.
it. Amdal In Home Care, right here on Central Valley Talk.